Hi. Actually, it was public procurement, sustainable public procurement. My name is Silvia Pastorino, and I work at the London School of Hygiene and Tropical Medicine. I'm a research fellow in nutrition, sustainability, and health. And today I'm going to talk about sustainable public food procurement, which includes procurement of plant-based food, of course, but it's actually broader than that. In the first part, I'm going to talk a little bit about the definition of sustainable public food procurement, its aims, possible outcomes, and a couple of examples, and then I will outline the results of a systematic review on the environmental and health and climate outcome of sustainable public food procurement policy. So sustainable public food procurement is a type of procurement that link institutional demand for food with sustainably, environmentally, socially sustainable food enterprise. So it means that the food usually is required to be of a certain standard from different point of view. It usually has different aims, which include social, economic, and environmental sustainability, just to name a few. To achieve this goal, there are multiple ways. For example, sustainable public food procurement can create a market for local and smallholder farmers by requiring food to come from a certain place. Or it could promote a certain way of growing food, for example, requiring ecological standards that have better outcome on the environment. Or it could require that certain food are increase or decrease or promote certain food in the institutional place, for example, by promoting planet-friendly and healthy diet. These sustainable public food procurement policies have been increasingly used worldwide to achieve different outcomes. As I say, including environmental and climate outcome, but also they are increasingly seen as an entry point for achieve food system transformation. The reason why it's seen as a particularly strong policy is there are multiple. So first, they can affect a large number of, very large number of food that is produced and consumed and purchased. Just in Europe, it was about 85 million meals a day that were purchased by government just like last year. Also, they are very structurally effective, so there is already a structure in place. So this means that government can hold the lever to change and can make changes at large and can bypass kind of individual behavioral choices, basically create a change in the environment so they can facilitate choice. They also have both direct impact, for example, to obviously purchasing food for a certain group, so people can eat the food, so have a direct impact on what people eat. But also they can have a potentially important indirect impact. For example, setting norm, an example. This is particularly important. It can be particularly strong policy when you want to affect, for example, the diet of children when a time when there is particularly prone to make behavior, create dietary habits. Without talking too much about the first point, sustainable public food procurement can have a direct impact on climate change. For example, by purchasing healthy plant-based food and setting plant-based food as a standard, so that basically just directly reducing the amount of food that is served in canteen. They can all have wider benefit on water and biodiversity. For example, when the requirement of the tender are for a certain amount of food to be for farming system that use fewer pesticides, and maybe like they have a lower negative impact on the soil, and also that promote biodiversity. And this is actually has been quite widely adopted in various European countries where there is currently a significant push to increase the purchase of organic agricultural products. just to mention a couple of examples, probably not going to focus on Denmark because we have heard quite a lot about the Danish example. But for example, Sweden has a long-standing tradition of using public food procurement to achieve different goals, including social, education, and economic goal. But late in the last at least 20 years, they're moving more into the using sustainable public health procurement. And some example at the city of Malmo that adopt a policy, they have co-benefit for the health and environment. And they're really a true set of policy that work together, for example, increasing plant-based food, promoting organic agriculture products, also using environmentally friendly transportation. And also Sweden is quite advanced in how they approach decreasing institutional food waste. There is a Swedish food agency publication that actually is distributed to various institutional canteen on how this can be actually achieved in practice. Now we're going to talk about the systematic review, so like the more evidence bits. This is part of a larger project called PACE, which is policy and intervention for climate and health equity, which is co-led by UCL. And for the food stream, we decided to focus on sustainable public food procurement policy because when we were in talk with the Climate Change Committee, they were considering this policy of the government, the UK government, to achieve net zero, but they realized that there wasn't a lot of evidence. So we know from anecdotally that a lot of countries and cities and places are trying to adopt it, but sometimes there is not enough evidence. So sometimes it's not published or has not been collected. So all the good action that are happening there, and often you need some hard number, you need some evidence that is working, even though maybe you might think is working. So the aim was to evaluate the impact of different sustainable public food procurement policy that were implemented in Europe and in the UK. We only restricted this area because we wanted, the primary aim was to give recommendation to the UK government. So we wanted to some policies that were broadly applicable to the UK. So first, we wanted to review the impact of implemented policy, and secondly, on different outcomes. And secondly, we also wanted to look at the key barriers and facilitators of these implemented policies. All the population were accepted. The intervention time, again, like all intervention were accepted as long as there were implemented policies. Because one thing is to look at perfectly controlled trial in just a few places. Another thing is a look at the actual policy that have been implemented, the government and actually paid, approved. So the things that are happening or happen in real life. So we want to know what is the effect of this policy. The outcome, you want to look in the broad range of outcome to make possible to include as many studies as possible. So we have a health indicator. Again, we kept it quite broad. We assume consumption, purchase, or even selection of sustainable healthy food count as a health outcomes. And environmental, we kept it quite broad, but you will see that most of the environmental outcome is basically greenhouse gas emission. There is very little evidence on water and land use at the moment. We consider all type of trial, but because mostly these are implemented policy, the evaluation mostly comes especially in quantitative studies, come as pre and post studies, where the actual population itself can't act as its own control. Mostly so they were not controlled trial, but when you look at like changes, a very broad change affects many people, it's very difficult then to, especially for the government, they might not be willing to pay for a controlled trial at the same time. We're going to skip on the exclusion because basically the reverse of the inclusion. And then, okay, so the initial results, so the search result, of the 90 studies that we look at the full text, we included 14 in the analysis. These were a mix of quantitative, qualitative, and mixed method studies. Majority came from the UK, Denmark, and Sweden, but we have few other countries. And the great majority were policies that were implemented in schools. And the next one was all setting. Usually it means that they were implemented at the city level or country level, which also include the schools. So schools need to be one of the most likely settings, or at least one of the settings where has been more likely to be implemented. But there were one child setting, one hospital, and armed forces. So there was a mix of low and medium risk of bias. So they were relatively good quality studies. So this is the first summary of the results. So this is like the summary of the health, environmental, and acceptability outcome by type of policy implemented. The number of tickets is the number of time in the study, the number of studies that we saw a significant positive outcome between the policy action on the top and the outcome on the left. I grouped the policy action into three main buckets. The first, obviously, is the food, where it was the policy aimed to change the type of food, the way it was cooked, or the way it was promoted. And then there were waste, trying to reduce waste and trying to improve the environmental sustainability of the way food is transported. And you can see, the majority of the policy that were implemented, they were aiming to increase organic food. They were trying to increase local and seasonal products, or reduce meats, or increase plant-based food. The majority of the outcome that's been collected so far has been in the health outcome. That's also reflects a temporal change. So the older the study, the more likely were to look at health as a key outcome. The more recent the study, the more likely were to look at the environmental outcome, because this is obviously sometimes there is like a 5 or 10 years time before they can collect the outcome. So it's most likely there's going to be more studies that look environmental outcome in the future. As you can see, the outcome with the greatest having a strong association is an increase in the promotion of plant-based food, unhealthy plant-based food, or anti-sustainable plant-based food. And this often came hand in hand with an increase in consumptions in the study that measured that, because obviously this was not often measured. But also an increased positive attitude toward these foods. And the reduced meat and increased plant-based obviously had the highest impact on reduced greenhouse gas emissions. And the few policies that look at waste show that actually these were successfully implemented. So I'm going to really have to push. I'm going to really slow in this. This is actually interesting slide, because it showed that the average is a 24% decrease in greenhouse gas emission across all policies. But the ruminant meat, it was the major driver, and it's 30%. This is so much in line with what has been presented in modeling studies. So this means that this is actually possible to achieve in a normal policy setting. Very, very quickly on the barriers. The resource constraints were the most likely mentioned. These include perceived higher costs, limited knowledge and skill from the chefs or the staff. And the second is public resistance, negative attitude against plant-based, sometimes called fatty food, or also the bureaucratic inefficiency, like fear of catering, supply issues, restricting, complex, difficult to change procurement rules and contract, like lack of political will was only mentioned twice. But on the flip side, leadership, political support, and vision was mentioned as the most likely facilitator for the implementation success. And also an existing appropriate infrastructures. So when something is already there, it's easy to start a new policy rather than having to start from scratch. And then you can see all the different facilitators, knowledge is clear, this makes sense, financial incentive, but also public involvement, support network, enabling policy and contracts. So in conclusion, we can say that sustainable public food procurement policies they have been implemented, and they can be implemented with success. the main outcomes that were measured, so this is not that the other countries are not positive, these are the countries that been measured, we have found positive outcome, is they can lower, effective way to lower the climate impact of the food system. They increase fruit and vegetable and plant-based food offer and often increase the intakes where this is measured. They can reduce food waste, very effective measure to reduce food waste and actually save money at the same time. And they can improve attitude and knowledge. This has been particularly found in school and children. There are very few studies, unfortunately, that measure this outcome in a real implemented policy. But where this has happened, the children are very receptive and they often bring the knowledge home. It can change attitude at home. So this is actually a powerful one. The key barriers, I just say, perceived high cost, lack of knowledge and skills, and negative attitudes. But also, if we want this to happen, to have success, we need to remember that leadership and political support are probably the initial key factor to facilitate an initial change, even before we can think about the others. And obviously available appropriate infrastructure, or if not, probably funding for right infrastructure is necessary. Thank you.